Advanced Endocrine System Block for 7th Semester Medical Faculty. The Advanced Endocrine System Block is designed to provide a comprehensive understanding of the anatomy, physiology, pathology, and clinical management of diseases related to the endocrine system. The endocrine system regulates various bodily functions through hormones produced by endocrine glands. This block also explores the relationship between the endocrine system and other body systems, as well as holistic approaches to managing endocrine disorders. 1. Anatomy and physiology of the endocrine system. A major endocrine glands and hormonal functions. 1. Hypothalamus and pituitary gland. Hypothalamus controls the pituitary gland via releasing hormones, GnRH, TRH, CRH, GHRH, and inhibiting hormones, somatostatin, dopamine. Pituitary gland, anterior lobe, produces ACTH, TSH, GH, PRL, FSH, and LH. Posterior lobe produces oxytocin and ADH. 2. Thyroid gland produces thyroxine, T4, and triiodothyronine, T3, for metabolism. Produces calcitonin for calcium regulation. 3. Parathyroid glands produces parathyroid hormone, PTH, to increase blood calcium levels. 4. Endocrine pancreas. Islets of Langerhans secrete insulin, beta cells, lowers blood glucose levels. Glucagon, alpha cells, raises blood glucose levels. 5. Adrenal glands, adrenal cortex, zona glomerulosa, produces aldosterone, regulates sodium and blood pressure. Zona fasciculata, produces cortisol, stress response and metabolism. Zona reticularis, produces androgens. Adrenal medulla, produces catecholamines, epinephrine, norepinephrine, for fight or flight responses. 6. Gonads, ovaries, produce estrogen and progesterone. Testes, produce testosterone. 7. Pineal gland, produces melatonin, which regulates sleep cycles. 2. Pathology of the endocrine system. This block covers various disorders of the endocrine system, including a hypothalamus and pituitary disorders. 1. Hyperprolactinemia causes pituitary adenoma, prolactinoma. Symptoms: galactorrhea, amenorrhea, infertility. 2. Growth hormone, GH deficiency. In children, stunted growth, dwarfism. In adults, reduced muscle mass and bone density. 3. Acromegaly and gigantism, caused by excess GH. Gigantism occurs in children, epiphyses open. Acromegaly occurs in adults, growth of facial bones, hands. 4. Diabetes insipidus, ADH deficiency, right pointing arrow, polyuria and polydipsia. B. Thyroid disorders. 1. Hypothyroidism, causes, iodine deficiency, Hashimoto's disease. Symptoms, fatigue, bradycardia, dry skin. In children, cretinism. 2. Hyperthyroidism, causes, Graves' disease. Toxic adenoma, symptoms, tachycardia, tremors, weight loss. 3. Thyroid cancer, types, papillary, follicular, medullary, anaplastic. C. Parathyroid disorders. 1. Hyperparathyroidism, cause, parathyroid adenoma, symptoms, hypercalcemia, bone pain, kidney stones. 2. Hypoparathyroidism, cause, injury during thyroid surgery. Symptoms, hypocalcemia, tetany. D. Pancreatic endocrine disorders. 1. Diabetes mellitus, type 1, autoimmune destruction of beta cells. Type 2, insulin resistance. Symptoms, polydipsia, polyuria, polyphagia, weight loss. 2. Hypoglycemia, causes, insulinoma, insulin overdose. E. Adrenal disorders. 1. Addison's disease, deficiency of cortisol and aldosterone. Symptoms, hypotension, hyperpigmentation. 2. Cushing's syndrome, excess cortisol. Symptoms, central obesity, moon face. 3. Pheochromocytoma, tumor of the adrenal medulla. Symptoms, episodic hypertension, palpitations. F. Gonadal disorders. 1. Male hypogonadism, causes, Klinefelter syndrome. Testosterone deficiency. Symptoms, infertility, gynecomastia. 2. Polycystic ovary syndrome, PCOS, causes, insulin resistance, hyperandrogenism. Symptoms, hirsutism, irregular menstrual cycles. 3. Diagnosis of endocrine disorders, a history taking and physical examination. 1. History. Symptoms, fatigue, weight changes, sleep disturbances, menstrual irregularities. Family and dietary history. 2. Physical examination, inspection, hirsutism, purple striae in Cushing's. Palpation, thyroid enlargement, measurements, blood pressure, height. B. Supporting investigations. 1. Laboratory tests. Thyroid profile, TSH, T3, T4. Fasting glucose, HbA1c. Cortisol and ACTH levels. Sex hormones, testosterone, estrogen. 2. Imaging, thyroid ultrasound, pituitary MRI, adrenal CT scan. 3. Dynamic tests, ACTH stimulation test for adrenal insufficiency. Dexamethasone suppression test for Cushing's. 4. Management of endocrine disorders, a pharmacological therapy. 1. Hormone replacement. Levothyroxine for hypothyroidism. Insulin for type 1 diabetes. 2. Hormone inhibitors. Propylthiouracil, PTU, for hyperthyroidism. Aldosterone antagonists, spironolactone. 3. Symptomatic medications. Bisphosphonates for osteoporosis in hyperparathyroidism. NSAIDs for pain in PCOS. B. Non-pharmacological therapy. 1. Diet and lifestyle. Low-sugar diet for diabetes. Regular exercise for PCOS. 2. Patient education. Importance of treatment adherence. C. Surgical interventions. Resection of pituitary adenoma. Thyroidectomy for thyroid cancer. Adrenalectomy for pheochromocytoma. 5. Practical training in endocrine system block. 1. Laboratory test interpretation. Analyzing hormone levels. 2. Clinical case simulations. Management of diabetes, hypothyroidism, or hypercalcemia. 3. Minor procedures. Blood sampling for hormone testing.